3 warning icons. Chemotherapy drugs are high-alert medications with no standard dosing guidelines, meaning even the smallest error can be fatal. Because every single dose requires a unique calculation, you serve as the final safety check before administration. Mastering dosing mathematics is a direct life-or-death requirement for patient survival. This calculation breakdown outlines the first step of the protocol, determining the patient's body surface area, or BSA, using their specific height and weight. The next image displays the dose formula. In step 2, you take that established BSA and multiply it by the prescribed drug's specific milligram per square meter requirement. This side-by-side comparison demonstrates how 2 different drugs yield radically different final doses for the exact same patient. Even with a consistent BSA of 1.75, the doxorubicin and cyclophosphamide outcomes are completely distinct due to their unique multipliers. Because these multipliers vary so drastically, assuming a baseline dose expectation is incredibly dangerous. Every prescription demands a fresh 2-step calculation. This introduces the deadliest drug exception, vincristine. Notice the crossed-out formula and the corrected hard cap of 2.0 milligrams. This limit applies regardless of calculated BSA. Failing to recognize this cap causes fatal neurotoxicity. This IV bag illustration details a second major operational failure, unit mismatch. You must convert grams to milligrams before doing any multiplication, as highlighted by the yellow warning rule. Memorizing the core formulas will not protect a patient if you fail to enforce hard drug caps or misalign basic units of measurement. This working backwards graphic shows how the dosing formula can be run in reverse. By dividing the prescribed dose by the drug's milligram per square meter requirement, you can verify the BSA used to generate the doctor's initial prescription. On this standard prescription, locate the required auditing variables in the top right demographics block and the calculated dose line. You must also scan for critical administration warnings, like this instruction to stop if there are signs of extravasation. Reverse engineering the math is your ultimate failsafe against upstream prescribing errors. This summary checklist outlines the end-to-end standard operating procedure. Calculate BSA, check multipliers, convert units first, and enforce all caps, along with the bonus reverse math step. Strict adherence to this protocol allows you to operate safely. By acting as a rigorous, mathematically sound final checkpoint, you ensure the safety and survival of your patient.